Premier Doug Ford dropped a bombshell today. He's been under intense criticism after the military, not government inspectors, uncovered horrific conditions inside 5 long-term care homes hit hard by COVID-19. Well, today the Premier went on the defensive and said the union refused to do in-person inspections and would only do them by phone.
Let me be fair to them too. That's why I've been taking the bullets for them every time people ask me that question. You know, I understand they were scared. This is in April. This was the peak of COVID, and all heck was breaking loose, and they were nervous about their families. They were worried about their health. I get it. You know, they aren't medical professionals, so I understand it. But I'm not going to continue taking bullets for something that there was no control that we had when the unions refused to go in.
The Premier's office released this letter from the union head, Smokey Thomas, dated April 22nd. It details safety concerns and notes most, if not all, inspections were being done on the phone. It states the government's desire for in-person inspections was, quote, ill-advised and not necessary. Now remember, what the military uncovered was horrific. Patients who were force-fed to the point of choking, unsanitary conditions, COVID-positive patients allowed to roam. And for a full month, what we've learned today, for an entire month, there were absolutely no in-person inspections. The union, though, is denying that they refused to go inside.
There wasn't as many, perhaps, as they wanted. Some of my members actually volunteered to go in without adequate protection. I question the wisdom of that, but they did. They went in, and they were the management again. The supervisors of the inspectors told them to phone the homes and do extensive phone interviews. So there were some inspections going on. I couldn't tell you which homes for sure, but it's not like people weren't raising the alarm bells.
The fact is, long-term care homes have been in crisis for decades, and it will be a mammoth task to turn the system around. COVID-19 has made the situation impossible to ignore, so maybe now there is the political and public will to change it. As for the COVID numbers released today, there's been an interesting change in community spread numbers. Before the weekend, new COVID cases that were traced to the workplace or gatherings were counted as community spread. Now they're being counted as close contact. This is important because the Chief Medical Officer of Health has said he wants to see community cases go down before he further opens up the economy. Well, they have gone down. Under the old system before the weekend, community spread was 34% of all cases. Now, after the change, community spread is 18%.